Hello again everybody and welcome to my YouTube video channel. Today I'm actually going to be talking to you about bipolar disorder and disruptive mood dysregulation disorder in children and teenagers. Hello, my name is Tracey Maxfield. I'm a nurse, author, stop bullying, mental health awareness and suicide prevention advocate, peer specialist, and lots of other things. Anyway, this is another video in my series reviewing bullying, mental illness and suicide in our children and teenagers, and what we can do as parents, family members, concerned citizens, teachers to help our kids. So I'm sure a lot of you have heard of bipolar disorder, but disruptive mood dysregulation disorder, which is more than a mouthful, so I'm going to refer to it as DMDD, is a relatively new psychiatric diagnosis in the DSM-5, that psychiatric Bible per se. The reason why it's a relatively new mental illness or mental disorder is for decades many psychiatrists kept misdiagnosing DMDD for bipolar disorder. And it was actually a few years ago, a 6-year-old boy in New York City, whose father's a psychiatrist, had been treated for bipolar disorder, and the medications just weren't working, and in fact the behaviours were becoming worse. And finally, it was after a lot of reassessments and reviews that they determined that this in fact was not a bipolar disorder, but the poor boy was suffering from DMDD. And once the medications were stopped and alternative treatment options started, they did find they were able to regulate his moods and his emotional outbursts. So first of all, bipolar disorder in children and teenagers affects approximately 1 to 3%. And we have seen that children as young as 4 years old have been diagnosed with bipolar. There's bipolar level 1, where in order for a confirmed diagnosis, you have to experience a manic episode and a depressive episode. And then we have bipolar 2. And in bipolar 2, you have had to have experienced a hypomanic episode and a major depressive episode. Now, children and teenagers who are experiencing bipolar are going to have mood swings, hyperactivity, grandiose sense of self. That can be quite challenging. They can be very irritable, have anger outbursts, be very verbal, but they can also then be very depressed and sad and inert and not functioning too well. And that's when they have the depressive episodes. These will be episodic. In between the episodes, the child or the teenager presents as just a normal kid. But what we're finding is that it can actually be very disruptive, not only at home, but also in the school. And so it's very important that the school, the teacher, the principal, and the counselor is involved to help, because as you can imagine, when the child or teenager is in a manic stage, they run on no sleep. They're very, very busy. They're very restless. They're very creative. They don't need to sleep. And then, of course, when they counter with the depressive episode, schoolwork will suffer, and they're sleeping all the time, and they just have no energy. And so, as you can imagine, it is very, very challenging, not only for school, but also for the child and teenager and for the parents. A very, very thorough diagnosis needs to be made so we don't confuse it with DMDD or ADHD or even depression. And it is actually possible to have a diagnosis of bipolar with an ADHD and a depressive disorder. It's very overwhelming, as you can imagine. Treatment, once there is a correct diagnosis, is medication, and that's usually The old standard we hear about lithium, which is actually an antidepressant. If there's anxiety, there may be an anti-anxiety medication, but treatment is lifelong. And because we have a child or teenager whose brain is continually developing and growing, as is their body, the meds are going to be adjusted as they age. So it's imperative that they continue to see the psychiatrist and the therapist or counselor and their family doctor, so the correct dose of medication is given. Supports include the school support, as I've already mentioned, and also individual counselling, talk therapy, and family therapy is very important. For the parents, I would suggest that you have to be very patient and start keeping a daily life chart or a mood chart to recognize when the cycles are starting, whether any potential triggers, how long they last. Keep to the treatment regime, the medication, promote a healthy lifestyle. So that's exercise, good eating habits, socialization. And I think what you need to do is talk with and listen to your child. They're very much aware of when they're going into these cycles, and so help them take control and empower them so that they recognize them, and together you can work in maybe what can help to keep them safe, because they can be very impulsive in that manic stage, and also how friends and family respond, because again, any child or teenager that presents this as different or as symptoms that others don't understand is more susceptible to bullying, but also they're highly susceptible to substance use. And that's to help them deal with the ups and downs and the ups and downs. So I think for the parents, it's show love, and it's to be really supportive and be there and help them through the cycle so they learn to manage them as they go into young adulthood and then into adults. Now, DMDD, Disruptive Mood Dysregulation Disorder, is frequently diagnosed from the ages of 6 to 18. The difference between bipolar disorder is that the irritability, the violence, and the anger outbursts are seen on an almost daily basis, and they continue to get worse and worse and worse. For diagnosis, a child is supposed to present with these symptoms for a minimum of 3 times a week, but most parents respond that it continues, so it's almost daily, and absolutely nothing seems to help their child. This is the common statement that they say when they go and see a doctor or a psychiatrist. The only other difference between bipolar and DMDD is that bipolar is episodic. We just said DMDD is all the time, and the child or teenager does not have a manic episode with DMDD. That's very important to remember. And so what they're going to present with is constant, frequent outbursts. 1 minute they're fine, the next minute they're just screaming and shouting and hollering, and you just can't control them. And it's very frustrating, not only for the child, but also for the parents or the person witnessing that. And that's why it is imperative that if you're seeing these symptoms and signs repeatedly for months and months, you have to go to the doctor and get a diagnosis, because the sooner you can get an assessment done and a confirmed diagnosis, the sooner you can begin treatment and interventions in an attempt to help your child or teenager cope with this disorder. The challenge is many experts believe that the longer that you leave it, the more difficult it is for you actually to help your child or teenager, and they're going to go through life with this anger and irritability, and they're unable to read appropriate social cues, and they overreact to body language and communication patterns, and what happens is that you get a child that may turn to drugs or alcohol, may run off with the wrong crowd, may get involved in very risky reckless behaviours because they don't know what's happened to them, and they just cannot control these outbursts. And many of the kids in juvenile facilities actually have a DMDD because of that. What you need to do as a parent is bite your tongue, take a breath. I think you have to be very tolerant and very patient and show love. What is important is that when a diagnosis is made, you proceed with the treatment. They may be given medications to help with the moods, to help with the frustrations, the anxiety, the anger, but they'll need cognitive behavioural therapy, and I think what's good is talk therapy and play therapy, especially if they're younger, and individual and family therapy. Also, like bipolar disorder, keep a mood journal. Try and see what are the triggers. Are there any foods, incidents, things on TV? Maintain a good, calm environment and a routine. Any disruption to routine, any disruption to the environment is going to be detrimental, and they're going to overreact because they cannot process these changes. Whilst there is no definitive cause, what experts are now believing is that it's centered in the amygdala, sorry about that, in the brain. There's underactivity, and that is your processing of appropriate emotional responses. And so they are looking, now that it has actually been recognized as a mental disorder, they have more money to conduct research. So that's very hopeful and optimistic. I think as a parent, what you need to do is you have to remember that they're still a growing child or teenager, and so they're still going to have those normal outbursts, and the determination is when do you respond to the normal child having an outburst, or when do you actually say time out, and you're not going out, no phone privileges or something for a week or 2 weeks. As I said, as a parent, I think it's very important that you learn to take care of self, because it is very stressful, and you work towards having a good family unit where everyone is on the same page. And so when your child or teenager is having these episodes, give them permission to remove themselves to another room and have a timeout and try and calm down, and then talk about it later. And I think what is important is explaining that that is actually not socially appropriate behavior, and that in order to get on in this world, they really need to look at themselves, a little bit of self-reflection, self-evaluation, and decide that when they're getting angry, if they cannot diffuse, they have to leave, because they bring other people into it and it gets very nasty and hurtful. And so, yes, there is no, magic pill. There is no magic therapy. It can take up to 2 years of repeated, continual therapy and parental guidance and support, and the school is imperative. They need to understand as well that when these moods happen, then the child or teenager needs to have a timeout, needs to go to the principal's office and suffer the consequences of whatever they've done. This is not only to promote a safe learning environment, but also to help those around that are witnessing this, that they don't have to put up with it, and also enable the child or teenager to understand, okay, you know what you did was not right. We understand you have this disorder, but this is what we need to do. And so it is patience is all I can offer you. In my blog at www.traceymaxfield.com, it will be discussed in more detail to help you. And for those of you who are watching this video, please go to the magic button below, press it, and then press the little bell to give your email and subscribe. That would be greatly appreciated. And next week I'm going to be talking about strategies and tips for working with your child or teenager who has a mental disorder now that it's almost that time for them to return to school. What can you do to help your child or teenager transition more easily? What works, and what can you do as a parent so you feel good that you've promoted a safe, calming environment for your child or teenager. That's it for today. I hope you enjoyed this video, and I'll see you again next week. Have a good week.